We presented a trials in progress for the first-in-human CAR monocytes study for solid tumors with a HER2 positive expression. We previously worked on the first-in-human CAR macrophage study in HER2 positive solid tumors. This product, the CAR monocytes, is potentially superior to the CAR macrophages to where we're producing more cells in a shorter period of time. And in preclinical studies, it showed that it traffics better to the tumor and it lasts longer in the body. So potentially a superior product. So we're really excited about that. How the process works is that patients get apheresis. Their cells are taken where the monocytes in particular, we're transducing those monocytes with an adenoviral vector to produce that CAR and injecting them back into the patient. And in the patient, those CAR monocytes differentiate into macrophages and potentially stimulate an immune response by attracting antigen-presenting cells, T cells, and also the macrophages themselves engulf the tumor and initiate an anti-tumor response. So we've dosed the first patient, and we have potentially some patients in cohort 1 already waiting to be dosed. So we're pretty excited, and we'll keep you posted on the results of the study.